Doctors of Reddit, what is your most awkward experience when dealing with members of the opposite sex? NSFW. Somewhat related, but from a patient's perspective. When I was in nursing school, I went to my school's student health center for a gyno appointment. The doctor asked me if it was alright if a medical student was present. I said that was fine. She then specifies the student was male and asks me if that was still okay. I wasn't totally comfortable with that. But as a nursing student, I knew how much it sucks when a patient refuses you. So I said yes. Lo and behold, it was an incredibly attractive med student from my school who I bumped into all the time. And he saw the inside of my vag. I never could look him in the eye after that. Edit, a lot of people are commenting that he or I should have refused. I didn't actually know the guy. I just knew him as a hot stranger. And I think I became much more aware of his presence after this occurred. Not me, but a fellow classmate in medical school. We have mock exams, and various people will sign up to be patients. They get paid a decent amount. So he went in the mock exam room and started the basic history and physical on the fairly attractive female. Did this and that pretty standard stuff. Grabbed a tongue depressor and had her open her mouth. Then, nothing. He did it again. And said with bewilderment, "That is weird. You do not have a gag reflex." She smiled and gave him a coy wink. He about lost it and couldn't finish. He walks out and finds the preceptor who monitors the exam about rolling on the floor laughing. As for me, I never really had an overly awkward experience other than maybe knowing someone, which can make certain exams a little awkward. Not a doctor. Student rad tech. Had a patient for a regular chest x-ray series, but she was coughing up sputum. I asked her if she wanted a tissue to cough it up into, and she said she didn't spit. She was a swallower and winked at me. I'm 19. She was 98. A lot of women her age are swallowers. It's a behavioral trait that many whom survived the Great Depression have. With the widespread poverty during that period, one simply couldn't survive if they were wasteful. You had to utilize bits of things that would normally be discarded. Get an orange. Eat the rind. Acquire tattered shoes. Turn them into flip-flops. Skin is peeling. Add it to a stew. Find yourself with a mouthful of jizz. You damn well are swallowing the stuff. That's what it took to get by. Source. Patient here. I was in a small town where my parents used to live and I had to see a gynecologist. I was worried that I may have had a tampon stuck in my vag. That's not physically possible. But I didn't know that at the time, unfortunately. The only doctor I could see was a friend of my parents. After thoroughly probing and peeking, he informed me that there was nothing wrong. In fact, your vag is, for lack of a better word, gorgeous. I've never been so embarrassed. I had to babysit his kids that weekend. TLDR. Dad's friend tells me I've got a beautiful beaver and then I have to babysit his kids. Edit 1. RIP inbox. Edit 2. Apparently it is possible to lose a tampon. Edit 3. And now my second highest rated comment is about my vaginal. Thanks guys. ER in Brazil. 20-year-old woman receives a knife cut in the chest. Slides both of them across. Superficial injury, but it needed sticks. No plastic surgeon, sus ER in Brazil. Started the procedure. You like them, don't you? If you make them pretty again, you cannot play with them all you want. The nurse was mortified. This would go on for 45 minutes. As soon as the next DR iron schedule arrived, I was undying the sticks and referred her to the other DR and noped out of there. English is not my primary language. Sorry for any mistake. Edit. Thank you all for the language compliments. The main reason I comment on Reddit is to practice my English and I get free grammar Nazi corrections to learn. My doctor once said, "You're so thin. It's very easy to palpate your organs." Then he felt my spine from the front. It was awkward. When I was in nursing school, my lab partner was a Kenyan marathon runner. He was so skinny our teacher used him as an example all the time because you could literally see his heart beating through his chest in his intercostal spaces. And where his lungs were a little overdeveloped from running. He could take a deep breath and you could almost see the outline of his liver. He always had to take his shirt off and let people prod and grope him. I had one patient who had made her desire for me very public. But since I treated her entire family, I decided not to kick her out and continue to remain professional. In the midst of a bipolomania, she kept complaining of female issues. During her pelvic exam, I happened to look up and I saw a gigantic smile on her face. After the exam, in the hallway in front of a few residents, she said, "If you weren't my doctor, I'd duck your brains out." Perhaps I should have mentioned this earlier, but she was the only woman I've ever met who is a 0/10. She's the only patient who made me question my heterosexuality. Doctor here recently walked in on a new mother in a sitz bath with two breasts pumped, gulping away at her all the while her husband grins from ear to ear as I worked her up for a pubic bone injury. The newborn could sense my embarrassment. If it makes you feel any better, when I had my son, I couldn't have cared less if Macy's Thanksgiving Day parade trooped through my room. All sense of modesty went right out the door and I cared duckle who saw what part of me during my time in the hospital. If you were there to help me, have at it. And thanks for all you do, Doc. We appreciate it. Not a doctor but a nurse. Trying to insert a catheter on a guy with a micropenis inverted penis. My perspective may be off the scope of the thread since I'm a veterinarian, not an MD. In my experience, people who do not want to neuter their male dogs are always males. Having a frank discussion about the benefits of neutering with someone who is emotionally attached to their dog's testicles is pretty awkward. My pediatrician used to substitute this old male doctor sometimes without notifying anyone. It was almost always the days I was coming in for my sports physical. That feel when you're going to get your gonads touched by a lady doctor in your early teens and then seeing an old man snapping latex gloves on. Patient side of the story. I got a positive on a STD test. So to take the secondary test to make sure, I went to public health center located near me. The blood drawer person was extremely cute. So when she drew my blood I was striking up a conversation. Just to be friendly. She says, "You're awfully cheerful for a person that doesn't know if you have a STD or not." I tell her, "Well, you'll let me know if I do." She gave me a smile and left. When someone came back, I shit you not, I was facing the other way and said something charming flirty, only to turn around face to face with an old lady doctor. She even had a sense of humor and said, "You can call me when you know you're clean." She was the kind of woman you can tell that used to be pretty about 20-30 years ago. But old age took its toll. I got embarrassed, asked for when to come back for results, and left. Week later I go back, see the same old lady doctor, and tells me I'm clean. I left before any awkwardness bubbled up. Used liquid nitrogen to freeze genital warts off of a 20-something-year-old girl. After she touched her genital warts with her hands to show me where they were, I applied cryotherapy and left the room for a moment so she could get dressed. When I got back she proceeded to grab my hand and shake it. After touching all of her warts, without washing her hands. Edit, I could have gotten drunk off the alcohol absorbed through my skin from the amount of hand sanitizer I used after that particular incident. My classmate and I were at a free clinic performing our first ever pelvic exams on standardized patients. Classmate is a big woman pillager of man and gets to go first. He proceeds to insert his fingers to palpate for the bimanual exam. Our poor standardized patient shrieks right away. She promptly states that for all women's sake, he's gonna need to use one finger for those procedures from now on. As a third-year med student on OB, a 13-year-old giving birth, mother yelling at her in Spanish, telling the attending and myself she had one period and got pregnant over and over again. And then after delivery, the new mother says, "What color is it?" As an intern, Super hot first year med student I met after a party who hooked up with one of my bros week before comes into ER with STD. I had to examine : still haven't told anyone. As a third year resident, male to female pre-op transgender whips out pen 15 for proof in front of entire team. Funnier than awkward. As an attending last year, hot 30-year-old Brazilian asthmatic comes to see me and whips her fake giant bobs out when I asked simply to lift the back of her shirt. It's okay to listen. Insta banner. So I'm a little bit late. But I have something. I'm not a doctor, but a pharmacy technician. About a year ago, a young woman comes in very upset and turns in a prescription for a bunch of anti-anxiety and anti-psychosis medications. All is going well until I realize we are out of one of them and I have to tell her I have to order it for the next day. She was okay with it at first. But then I see tears building. I ask if she is okay and says yes. So I continue typing up the prescriptions. I want to say there was about 8 or 9. Next thing I know, she begins crying. She starts telling me that she was just released from a psych ward and she had tried to heal herself a couple weeks back. She rolled up her sleeves and her arms were covered in deep cuts. She began to ask me if I thought she would ever get reaccepted to nursing school because apparently they kick you out after getting admitted to a hospital for psychological symptoms. I had no idea what to tell her except that I hoped she got in and that if she worked hard they should give her a chance. I know this all may sound shallow, but I was not prepared for this. Nothing in pharmacy tech training told me how to react. So this was definitely my most awkward moment with the opposite sex. Not opposite sex, but I had a terrible same-sex doctor experience. I had to take a pregnancy test to receive the depot proverb shot. The first time you get it they have to make sure you aren't pregnant to avoid lawsuits. I got a call a few hours later saying the test was positive and I had to go back in 2 days to retest. The next time my levels dropped back to normal. When I went to talk to my doctor she said I had an ectopic pregnancy that ended up in a miscarriage and it wouldn't have happened if you weren't having sex. She was very religious and even though I was 20 at the time and I'm a long-term relationship she felt the need to express her personal opinions about premarital sex to me. I became very depressed. Dropped out of school. Had my records transferred and 6 months later saw a new obgyn. I told her what had happened and she informed me there was nothing in my charts regarding a miscarriage but there was record of a false positive pregnancy test. Long story short, my DR told me I had a miscarriage. I dropped out of school due to depression because of it. Find out 6 months later she lied to scare me out of having sex and it was a mistake, false positive. One of my friends was getting a physical for a high school sport I believe. And when it came time for them to check his gonads, the doctor says cough but apparently my friend thought he said hop. So here my friend is standing there. The doctor has my friend's boys in hand and my friend hops. Said it was the most embarrassing moment of his life. I had to put a Foley into a male PT. I'm young and female. He seemed nervous as I started. Right when I was about to insert the catheter with his pen 15 in my left hand and the catheter in my right. He abruptly asked if it would help if he was aroused for the procedure and proceeded to gain some girth before I could answer. I said no. Kind of unrelated but one time my uncle was in the hospital for a few days. And he had to give them a urine sample each morning. The last day, however, he was told by a nurse that he didn't need one. So he filled up the cup with apple juice and waited for his doctor. The doctor came in and saw the cup and told him he didn't need to pee in the cup that day. My uncle just shrugged and drank the cup. The doctor stood there speechless until my uncle and the nurse next to him burst out laughing. Not really opposite sex related, but almost any healthcare worker in the field long enough will have a story about the time a patient had visitors at bedside and they made the mistake of inferring relationships based on apparent age and gender. Mistaking a patient's wife for a daughter, and vice versa, is pretty classic. Never assume. Best thing I ever read on Reddit was a few weeks ago. Sorry can't find the link so I will try and repeat it here. Apparently a doctor used to keep a large rubber wrist and hand, partly clamped shut, in his office. When he was doing digital prostate examinations, the patient was invariably bent over forward with his pants down, and he would first place clamp the rubber hand on the patient's right shoulder. After inserting his digit for the exam, he would place his other hand on the patient's other shoulder and wait and see how long the reaction took. Long, but worth the read. And I am a real doctor. I was a senior resident supervising 2 interns on an overnight shift. For reasons that are beyond me, I got a call at 2 AM from the psych ward about a female patient with a bowel impaction that apparently could not wait until the morning. For the non-medical, a fecal impaction is a solid, immobile bulk of human feces that can develop in the rectum as a result of chronic constipation. Instinctively, I told one of the interns to head over there right away. However, he poo-pooed the suggestion, so to speak. I offered him a deal. If he did all the write-up and orders for the next 2 patients, I would take care of the bowel impaction. I thought he would at least take some time to weigh out his options or try to renegotiate. But there was zero hesitation. Realizing I got the bum end of the deal, with the other, female, intern at my side, I headed down to perform a disimpaction. The nurses had prepared the young woman in the fetal position along with a pair of gloves, some lube and a large disposable cloth for the discarded waste. Without further ado, I looped up my fingers and dove right in, pulling out huge chunks of stool from this woman. Usually, I can overcome these situations by breathing through my mouth. However, in this instance, smell had transcended into taste, and I might as well have been licking my fingers for lubrication. My mind began to wander. With each clump of rancid clay still I added to the pile, I grew more demoralized. It was Saturday night. My friends were out partying, and I was literally up to my wrist in sheet. Around the 5th or 6th swipe, my FML moment disintegrated into a high-pitched scream of wrong hole that echoed through the unit. I wish I could say I had switched hands before that moment, but alas, my sheety fingers had inadvertently traversed her most sacred orifice. Within seconds my heart was thumping and my scrubs were soaked in sweat. The rest is somewhat of a blur, but as I recall, after apologizing profusely, I had the nurses rig an enema to wash her out. I don't think I looked that intern in the eye again for the rest of the rotation. I can't remember what the patient had been hospitalized with, but I am sure we both had post-traumatic stress disorder after that. TLDR, Saturday night bowel disimpaction. Edit, formatting. When I was 13, I was in the band in 8th grade. It was my first year marching and I was just a little nervous wreck. I was on the bus from a football game on the way back to town, and my friends and I were playing Truth or Dare. It was all messing around and silly inconsequential stuff until my friend Eric decided to get serious. He knew I had a crush on this girl Brittany and decided to be an amazing bro and dared her to kiss me. She was all for it and I was incredibly excited. I had never kissed anyone before and my heart was pounding. I was shaking a bit as she sat next to me. Her hand came to rest on mine and an immense calm came over me. She looked into my eyes and I knew that this was going to happen. She leaned in closer, and for what seemed like forever, our lips drew close for a kiss. I closed my eyes and lightly pursed my lips, trying not to overdo it. Here it comes, I thought. I couldn't breathe. The bottom of her upper lip grazed the top of mine as I completely melted and her bottom lip landed somewhere on my chin. She immediately drew back, laughing, and told me she was gonna make out with me for a bit but not anymore. I turned extremely red, was embarrassed and felt like such a fool. I kicked myself a lot over the lost chance. Extremely awkward. I'm not sure how me being a doctor fits into this, but I'm sure you have your reasons for specifying. From a patient's side of things, I have a short story. Went to the urologist due to cysts on my testicles. He comes in for the exam and sits in front of me as expected in one of those low swivel chairs and tells me to drop my pants. Before I can say anything, the doctor is giving my nuts an exam. No gloves. Awkward as hell. At least he had soft fingers. Edit, autocorrect ducked me. When you get a vasectomy, you get your big dick taped to your stomach. A nurse came in to do the finishing after the procedure. She was middle-aged. And I'm guessing she probably got into nursing late. Because she was looking really nervous and uncomfortable. And anyone who's been in nursing more than a few years has had hands-on Pen 15 experience. She's kind of tentative and unsure about pulling the tape off. So I say, go ahead. It's been through a lot in its time. She got a big smile and ripped that sheet off of there. So she's totally cool in my book. My granduncle is a urologist and I got a boner from checking out one of his nurses when I was around 12. I then had to explain why I couldn't drop my trousers for an examination. He asked if I wanted to go to the bathroom to do something about that so we can continue the examination. I had no idea what masturbation was and he explained rather vaguely to me the gist of the operation. I didn't feel like trying it so we just sort of waited until it went away. I don't know if it was awkward for him but whenever I think about it I cringe myself into the fetal position until I can block it again. My first pap smear was at Planned Parenthood when I was like 15. The male doctor got me positioned then turned around to grab the speculum and said, "This is going to be cold." Quack. Quack. In a Daffy Duck voice and using the speculum like a duck's bill. Technically I was a medical student at the time. But I guess it still applies. While on my psych rotation me and my resident were called to the ER for a consult. Upon arriving we saw a slightly disheveled black lady with a crazy look in her eyes that was complaining about lower abdominal pain. The ER resident started to do a pelvic exam and suddenly backs away with a strange look on his face. The lady looks down at her crotch. Says "Oh that?" and proceeds to reach into her vag and pulls out an 8-inch tightly packed ball of wet paper towels. MFW she reaches across to me and the psych resident and says, "Here. I was keeping this for you." None of us to this day have ever forgotten it.